The year 2020 began like any other. People went to work, children went to school, but a new illness was spreading across the globe. This illness, COVID-19, was caused by a new coronavirus. It first appeared in Wuhan, China. By January 2020, the first case of COVID-19 was confirmed in the United States. The virus spread quickly. It reached major cities like New York City. Hospitals were overwhelmed with sick patients. The government took action. They advised people to stay home, schools and businesses closed. Life as we knew it changed dramatically. The United States faced a health crisis unlike any seen in generations. The virus was highly contagious. People could spread it before showing symptoms. There were no approved treatments or vaccines. Fear and uncertainty gripped the nation. People worried about getting sick and spreading the virus to loved ones. The pandemic highlighted existing inequalities. Communities of color and low-income areas were disproportionately affected. As the pandemic continued, the virus itself changed. New variants emerged. Some variants, like Delta and Omicron, were more contagious than the original strain. These variants presented new challenges. They could sometimes evade the immune system. This meant that even people who had been infected or vaccinated could still get sick. The fight against COVID-19 became a race against the evolving virus. In December 2020, the first COVID-19 vaccines were authorized for emergency use in the United States. This marked a turning point in the pandemic. Vaccines provided a powerful tool to prevent severe illness, hospitalization, and death from COVID-19. The rollout of vaccines was a massive undertaking. Millions of people received their shots at hospitals, clinics, and pharmacies. While vaccines offered hope, they also sparked debate. Some people expressed concerns about vaccine safety and effectiveness. Section 5. Navigating a new normal. The COVID-19 pandemic forced people to adapt to a new way of life. Mask wearing became commonplace. Social distancing measures were implemented in public spaces. Schools and businesses adopted hybrid models, combining in-person and remote participation. Virtual meetings and online events became the norm. The pandemic accelerated the adoption of digital technologies. Section 6. The economic earthquake. The pandemic had a profound impact on the United States economy. Lockdowns and business closures led to widespread job losses. Industries like travel, hospitality, and retail were particularly hard hit. The government implemented economic relief measures, including stimulus checks and enhanced unemployment benefits. The Federal Reserve took steps to stabilize financial markets. The pandemic exposed vulnerabilities in supply chains and highlighted the importance of essential workers. Section 7. The mental and emotional toll. The COVID-19 pandemic took a toll on the mental health and well-being of Americans. Social isolation, fear of illness, and grief over lost loved ones contributed to increased rates of anxiety, depression, and substance abuse. Healthcare workers faced immense pressure and burnout. The pandemic exacerbated existing mental health disparities. Access to mental health services became even more critical. Section 8. Lessons from a pandemic. The COVID-19 pandemic has been a time of profound challenge and loss. However, it has also revealed the resilience and compassion of the American people. Communities came together to support each other. Healthcare workers demonstrated extraordinary courage and dedication. The pandemic underscored the importance of public health infrastructure, scientific research, and global cooperation. It highlighted the need for clear communication, trust in experts, and equitable access to healthcare. Section 9. The path forward. As of early 2025, the COVID-19 pandemic is not over. New variants continue to emerge. Vaccination efforts are ongoing. Scientists are working to develop new treatments and therapies. The path forward requires continued vigilance, adaptability, and a commitment to public health measures. The lessons learned from the pandemic can help us navigate future health challenges and build a more resilient and equitable society.